Welcome to a mindfulness program adapted for adolescents with chronic pain. We're glad you're here. My name is Angie Hunt, Project Manager with the Canadian Institute for the Relief of Pain and Disability, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC Government, as well as donations and memberships to CIRPD. We thank our program partners, Pain BC, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We'll collect questions submitted throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week, along with the slides. You'll be emailed direct links for all of these items when they are available. As I mentioned, my name is Angie, and I'll be moderating the webinar and Q&A session. Our presenter today is Dr. Danielle Ruskin. Dr. Danielle Ruskin is a clinical and health psychologist who works full-time in the chronic pain clinic at the Hospitals for Sick Children. Dr. Ruskin completed her PhD in clinical psychology at the University of Rhode Island and is an adjunct member of the Department of Psychology at York University. Dr. Ruskin provides consultation, assessment, and treatment to children with complex chronic pain conditions. Dr. Ruskin has a research program looking at the effectiveness of mindfulness and acceptance approaches for children with health conditions such as chronic pain and inflammatory bowel disease, and is appointed as co-chair for the Ministry of Health and Long-Term Care's Pediatric Pain Network Education Committee. And now I'll turn it over to Danielle.
Hi, everybody, and welcome to this talk. So I'm coming to you from Toronto, from the Hospital for Sick Children, where it's a beautiful sunny day out my window. It's about over 30 degrees in Toronto for the past week. So we've been enjoying a late summer. It's been a cold summer over here. And I've been working as a health psychologist in the chronic pain clinic here at Sick Kids for the past 10 years and started the work at developing a mindfulness group for the adolescents in our program about 6 years ago after having an interest in mindfulness myself. And today I'm going to really talk to you about some clinical examples of how mindfulness can be helpful for individuals, really for many people from different walks of life, but I'll use an example of chronic pain. And I'll talk to you a little bit about the group that we've developed. And the group is interesting because it's been adapted for teens with chronic pain. So the material of a typical MBSR course has been adapted to target and be applicable for teens with chronic pain. So what I'm going to start off with is describing a little bit about what is mindfulness. Some of you listening may have lots of experience with mindfulness, but some of you may be completely new to it. So we'll talk a little bit about what it is. We'll talk about how it is applicable, how it might help with the suffering and distress for people with conditions, health conditions, mental health conditions. We'll go through the evidence. So what are some really nice papers, systematic reviews, both looking at adolescents and adults, looking at the effectiveness of mindfulness. And I'll introduce you to a bit of the neuroscience research, which is a really exciting area that's showing really exciting changes in the brain, even after very minimal mindfulness training. And then we'll talk a little bit about the group that we've been running here at Sick Kids through a research program. All right, so let's start off by looking at, first of all, I wanted to actually draw your attention to this article that I found in JAMA Network. And this is describing the Center for Disease Control and Prevention's recommendations for opioid prescribing guidelines. And as we know, there's a opioid crisis going on, especially in this country. In Ontario, there's stories every day on the radio, and I know in BC, it's a huge problem. And the Centers for Disease Control and Prevention are advocating for non-pharmacological strategies as one of the first things prescribers should think of. So giving people, stakeholders, patients, these non-pharmacological techniques that they have no side effects, they're not addictive, and they are effective for helping with pain management and the secondary distress that can result from having pain. So what mindfulness is not is what we call being on autopilot. And many of us can relate to this in our lives of, being completely stuck in our head, daydreaming, thinking about something that's happened in the past. So maybe an interaction that you had with a coworker or with your partner or with your kids. Sometimes it can be the thoughts in the past that were very pleasant, dwelling on a cottage trip that you had and you're thinking about all the wonderful things that you experienced. But oftentimes we can dwell in distressing thoughts, an argument that we had with someone, being self-critical with ourselves. And sometimes our thoughts can dwell in the future. We can start ruminating about things that are going to be happening, worrying about some event that will be happening. And when we get stuck in this autopilot mode, we completely miss out on what's happening in the here and now. And especially if these thoughts, when we are thinking about the past and kind of getting hooked and ruminating into these, this kind of cycle of thinking, those thoughts can often be distressing. And can be energy sucking and can lead to a lot of physiological consequences for us when we're not even actually experiencing these events. So if you're thinking about a difficult, challenging situation that you encountered last week, your heart might be beating, your muscles might be getting intense, even thinking about that scenario. And so we can imagine that for people with chronic pain conditions, when they begin to dwell and ruminate about things that have happened in the past, maybe about the athlete or the things that they used to do before they had their pain condition, or maybe when they think about the future, about, are they going to be able to achieve their goals? Are they going to be able to go out with their friends for that party next week? Those thoughts can be very distressing for them and can lead to actual muscle tension and arousal of the fight or fight system that can make their pain worse. And so what we really try to cultivate in teaching mindfulness is an ability to unhook, to get unstuck from those unhelpful cycles of autopilot thoughts and come back to the present moment, to the breath, to cues in the environment. And through doing that over and over, that process of unhooking from rumination, from autopilot mode to present moment mode, we strengthen that capacity to be able to unhook from distressing experiences. And that really is what we're trying to cultivate in mindfulness. So John Kabat-Zinn, many of you may have heard his name, is one of the fathers of bringing mindfulness meditation to behavioral medicine. And he did this in the 80s. And he actually practiced meditation himself. He is a practitioner and had a practice of this on his own, and was working in a hospital where chronic pain patients were being seen, and had known that these patients were essentially being told by their primary care physicians that there really wasn't much else that could be done for the pain, that there was a host of medications that had been tried and other strategies, and the patients were still left with some degree of pain. And John Kabat-Zinn was curious about whether mindfulness meditation might be able to help these adults with chronic pain conditions because of this ability of mindfulness to teach, being able to have a different relationship with uncomfortable experiences, either emotional or physical. And he began to publish the first studies showing the effectiveness of mindfulness for people with chronic pain. And he came up with this definition of what mindfulness is, which is right here: paying attention on purpose in the present moment without judgment, and really approaching one's experience when we are paying attention on purpose with an attitude of compassion and kindness, which is so important when we're sitting with discomfort, when we're trying to close our eyes and breathe and experiencing some kind of physical discomfort or maybe some emotional discomfort, anxiety, to be able to have a gentle and tender approach when we're trying to sit with that, so that we don't get into that fight with those with those aspects of our experience. When we do our groups with the adolescents, with the teens, we present this definition to this, but we also use different terminology that might be a bit more accessible for the teens. So trusting the process, which is like an openness to experience, letting go, that idea of letting out, letting go, non-judgment, patience, and acceptance. And we actually have posters with these words that surround us in our group room, and we refer to them often during the group. And the teens, as we work through session 4, session 5, session 6, the teens begin to say, you know what, this week I just started to trust the process. I just said, you know what, I'm just going to trust the process. And it really changed my experience. So they really take in these words, and it's nice to have them surrounding us when we're working together every week. So how can mindfulness-based interventions help people with chronic pain? And I'm going to speak a bit about chronic pain when I go through this example, but you can think of anyone in your life that you might be working with or that might be suffering. Maybe it's another health condition, maybe it's a mental health experience that they're struggling with, but you can think about maybe that person as I'm going through this example. So what we have usually in our clinic is someone who comes in with a primary pain problem. So they have these presenting issues. This is a person who has very intense and excruciating pain in their hand. It's got a neuropathic component, which means that it's nerve pain, which can be tingly, pins and needles, sometimes numb, and it also has a musculoskeletal component, which can be achy and sore. And this person's life has really been disrupted by their pain. They're an artist, and they find that they can't use their hand anymore to draw. They can only draw for short periods of time, and of course, this has led to a lot of suffering and distress. So we have the primary pain sensations, the pins and needles, the numbness, the tingling, the aching. Those are kind of the primary pain symptoms. That's the objective symptoms of pain. But what we see happen over time for people who are dealing with these symptoms on a daily basis for months and sometimes years is that secondary suffering can develop. And what secondary suffering describes is all the thoughts that begin to come into mind about the primary issue. So we hear all the time teens telling us, I can't stand the pain. I'll never achieve my goals. I'm afraid the pain will get worse. My friends won't want to be with me. There's a lot of not wanting people to feel pity for them. There's a lot of isolation that can develop because they don't want to burden others because they can't walk as fast or can't do as much. So we see all these distressed thoughts about that primary issue. And then we see all the emotions that can contribute to distress and suffering. So a lot of anger, why did this have to happen? Sadness, often about the disruption that the pain has caused in life. Sometimes shame over feeling that they're burdening. The teens sometimes will talk about feeling like they're a burden to their parents. They know that their parents have had to take them to all these appointments. So there's all this secondary suffering that is attached to these objective symptoms. And then we see the behavioral things that can happen, that when any of us are dealing with discomfort, sometimes we can develop habits or ways of coping with it that's just the best we can do. So a lot of the teens will tell us in our clinic that the best thing they can do for their pain is to sleep. That's a way to deal with the discomfort, but then they end up missing some school. And we know that many of the teens that I see, when they're just struggling with an uncomfortable emotion, sometimes they are resorting to cutting because it's too intense. The emotion is too intense, and they'll cut. And for some, that will provide a bit of distraction. And so we can see how not only do people have the primary symptoms that they're coming in with the objective features of their pain condition, but they're also bringing with that all this secondary suffering. which leads to a tremendous amount of distress. And John Kabat-Zinn, who I spoke about just a moment ago in the other slide, has this really meaningful saying that sometimes pain is unavoidable. Sometimes pain is going to show up, or if someone has an anxiety disorder, sometimes their anxiety is going to show up and there's not much we can do about it. But suffering, all the secondary suffering, all the thoughts about the pain, the emotions about the pain, the impact of pain taking things away from our lives. So, feeling like we need to sleep it off, or avoiding situations because for someone who has an anxiety condition, because the anxiety is taking over, the suffering is optional. So that suffering, those thoughts about the primary condition, the emotions, is something that we can have some choice over. And mindfulness is a vehicle to give us the space to have a choice of how we respond to our experience. And I'll talk more about that so we can really feel that. So how can mindfulness help? What's really important is this concept of responding versus reacting. And those two words are very different. Reacting describes what all of us engage in, which is kind of knee-jerk reactions to our experience. So I'm sure we can all think of an event that happened in our lives in the last few weeks where we might have responded to someone, some situation in a way that we didn't feel great about, that we kind of responded in a knee-jerk fashion. And responding versus reacting, responding is creating a little bit of space between the event that's happening to us. So maybe you're engaging in a conflict with a colleague or with a partner, and giving a bit of space before you respond so that you can just take a moment to respond with more intention, so that you can say, you know what, right now I really want to advocate for myself, or right now what's really important for me is to preserve this relationship, and then responding accordingly. So it gives us a bit of space to take a breath and allow ourselves to settle just a little bit, and then respond in a way that is more intentional to our experience rather than this reactionary mode. The other thing that mindfulness teaches is really being able to use the breath as an anchor to the present moment. So coming back to the breath and really feeling it connecting us to what's happening in the here and now. Or some people like to use cues in their immediate situation, so visual cues. So looking out the window, looking at a tree, kind of waving in the breeze. That can be a very powerful way of grounding into the present moment and getting unstuck from unhelpful experiences, whether they're physical or emotional. And then finally, this ability to simply notice our experience, kind of like a scientist or an explorer, this more dispassionate stepping back, giving space to our experience, not getting fused with them and hooked by them. And what people are seeing is when they begin to practice meditation, mindfulness meditation, they can develop an ability to step a little bit back from experiences that would have grabbed them before, so that they don't get as charged up by those experiences, whether they be physical or emotional. So this is a teen from our mindfulness group, and in this practice, what we do is we ask the teens to actually, and this is probably in the 4th session of an 8-session group, so we don't do this very early on in the group, but what we want to help the teens do is to begin to be residing in their bodies, to have an ability to be with those really uncomfortable experiences, and develop, and in so doing, develop a different relationship with them. So many of us, if we're experiencing some kind of distressing experience, we really try to get away from it. We try to resist it in some way, whether it's kind of if someone has anxiety, it might be shifting around in your chair or looking for the closest exit, and really not just trying to sit and bring some openness and space to that uncomfortable experience. But if we can learn to give some space and openness to that experience, we might be able to see that that experience passes and that we can actually tolerate it. And so what we're doing in these later sessions of the group with the teens is getting them to investigate discomfort in their body and look at it kind of in a visualization type way. So in this visualization, we're asking them to visualize, to go to a place where they're experiencing some discomfort, and they don't have to go to the place that's the hardest for them in this moment. They might want to choose an area that is a place where there's a bit of discomfort, and they might want to start with that area, not the hardest area. And then we get them to visualize different aspects of that area of discomfort. How much space does it take up? Is it taking up a lot of space? Is it taking up just a little bit of space? What color is it? Is it red and hot? Is it blue and cold? Is it solid like a brick, or is it fluid like water? Does it move fast? Does it move slow? Is it heavy? Is it light? So we give them all these cues to pay attention to. Is it prickly? Is it smooth? And then we get them to draw what they visualized. And you can see with this young lady, she has pain in her hands, and she's drawn these areas of discomfort in her hands. And then what we get them to do is, in the second step of this practice, is to go back in and to really imagine relating to that experience, that area differently, so that they're going to relate to it with softness and kindness, almost as if they were approaching a little creature who needed to be helped, maybe a little puppy or a little kitten. They really can, I think people can relate to that, that's suffering in some way, and you stumble upon this little baby animal that needs to be rescued. And really thinking, like, how would you approach that little animal? What would your body tone be like? What would your voice be like? How would you look at it? So to give it a sense of safety and a sense of calm. And then can you go back into your body right now and see if you can go into that area that you were just with that same attitude, imagining that it is that little creature that's suffering. How would you look at it? How would you approach it? What tone of voice would you use? If you had to pick it up, how would you hold it to show that you're someone who's safe, that you're there to bring comfort and protection? And when we think about those words and that attitude, there's just a general sense of softness, of tenderness that comes up. And if people can begin to relate to that experience just a little bit in their bodies in that way, they may have a very different experience with that area of discomfort, sort of an opening and softening towards it. And what this young lady, you can see in her drawing, experienced was she visualized holding her pain lightly. You can see her hand is open and that pain is just sitting there. And she described it as a very helpful experience for her because she had a very negative relationship with this pain in her hand that she really felt was something that she detested, that she had so much anger towards, a lot of it had caused so much worry and distress for her. And so relating to it in this different way, in this attitude of softness and kindness and comfort, was different. So that's an example of this idea of relating to experience differently. Okay, so now let's see if we can do a little bit of practice together. This is for those of you who have a mindfulness practice. You can settle in and begin closing your eyes. And for those of you who are just practicing mindfulness or meditation for your first time, just know that sometimes your mind may wander during this experience, and that's totally normal. If you notice your mind wandering, just bring your attention back to your breath, back to my voice, and that is the act of mindfulness, of just bringing your attention back. So if you notice your mind wandering, just bringing it back to my voice and back to your breath. And there's a beautiful picture here to make us all feel a little bit calm. So just settling into your chair, we're just going to do a moment or two of mindfulness. Closing your eyes And just allowing your body to settle onto your chair or wherever you are. And I'll invite you to come home to your breath that has been there all day, coming and going. And now we're just going to pay some attention to that breath coming in and out. And just noticing where your breath might be most prominent, maybe at your nostrils or your throat, or maybe your chest. And just feeling that breath coming in and out like a wave in the ocean. Just allowing that breath in and out. And now taking a nice breath in, we're going to exhale. And as we exhale, we're going to turn our attention to the quality of our thoughts and just notice how quickly our thoughts are moving. Are they moving kind of slow? Are they coming in quick? Does our mind feel blank? And we're just going to notice like a scientist exploring what's happening with our thoughts, not noticing the actual content of the thoughts, just noticing how quickly our thoughts are moving or how slowly our thoughts are moving. And as you do this practice, just do it with an attitude of gentleness and kindness, trying not to judge, just trying to be here and just noticing. And we'll just turn our attention now with our next out breath to the quality of our emotional experience. So just noticing any emotions that are popping up, and try to do it like a scientist, like you're an explorer, just noticing kind of without too much passion, without too much reaction, just noticing if you feel a bit agitated or maybe you feel calm, just observing. And on our next out breath with an attitude of kindness and gentleness, we're going to turn to our physical bodies and just notice where we're at today in our physical bodies, if we're feeling kind of tired and heavy or tight, or maybe we're feeling kind of loose and relaxed. And again, practicing noticing your experiences like a scientist, like an explorer, with a bit of distance from them, kind of like you're looking at them from far away. And maybe if there's any tension there, just gently relaxing and letting go of any of that tension. And just coming back to your breath. And we'll just return your attention to the talk and the screen. And so that was a experience of going into the present moment and really noticing, like a scientist, our experience. And that might be an exercise that we do with the teens in our group. That might be an opening exercise that we might practice with them, just noticing their thoughts, the quality of their emotional experience, the quality of their physical experience. So mindfulness helps in multiple ways, and one way that I've highlighted at the top here is really this idea of exposure. This idea of if you can approach your areas of discomfort, emotional or physical, with a bit of distance, with a little bit of dispassion, so not with this attitude of feeling very intense with them. So giving them space, we can actually desensitize and reduce this catastrophic feeling that people can have when they're face to face with discomfort. So if we can practice and cultivate over time, this isn't an immediate thing, but over time, this idea of being able to bring some space between our discomfort and how we experience that discomfort, we can begin to reduce our emotional reactivity and our sense of suffering towards those primary sensations, those primary experiences. So I'm going to go through, if you went and signed up tomorrow for a mindfulness-based stress reduction course, I call them MBI, Mindfulness Based Interventions, this is kind of what you would get. It would be an 8 to 10 week course, 2 to 2.5 hours per session. And the big components would be something called formal meditation, which is things like body scan, where you attend sequentially to areas of the body. You're just noticing sensations and letting them be. And we're also learning about what we call informal meditation. And the teams that we work with really talk about bringing in this informal meditation into their everyday life, being more mindful and present when you're in class, noticing yourself sitting on the seat, looking out the window, noticing the trees blowing in the wind, when you're walking between classes, just feeling your feet on the floor, listening to the sounds around you. Those are kind of ways to be mindful in the moment, and it's not as onerous as this idea of formal meditation of lying down for 15 minutes and really practicing a body scan, although those components are very, very important and are, like going to the gym for your brain. But formal and informal meditation are routes to develop mindfulness. And then the third component is this idea of cultivating compassion towards the self. So being less judgmental, softer, more tender with the self and with our physical experiences and our emotional experiences, and also more compassionate to others. Home practice is a big part of MBSR, so doing practice every day while you're in the course, that really strengthens the brain's ability to feel like it can do this practice of coming back to the present moment and unhooking from that autopilot mode. And then gentle yoga practice is usually part of the adult MBI. So I'm going to show you how we've modified the mindfulness-based stress reduction for teens. And what we've done is we've really reduced the session length. So we do about an hour and a half to 2 hours. We make the sessions much more experiential. So we have a lot of fun activities, painting, finger painting, improv, music, and it really helps to connect the teens to the experience. It's fun, it's playful, and it's introducing mindfulness concepts in a playful way that I think teens really relate to. Does it mean that you can't be serious and really do some intensive mindfulness meditation practice? No, we do that as well, but I think it creates a really nice environment where the teens want to come back week after week. We tend to make the meditations shorter, so 5 minutes to 35 minutes, and we supplement with suggestion of using apps like the Stop, Breathe, Think app, Beautify app to encourage home practice, and some of the teens really like having those apps. And we really try to be mindful of the ages in the group. So I'll make that point later, but we don't want to have one 12-year-old and 7 18-year-olds. We want to really make sure that we have a smattering of ages across the group, because kids who are 12 are at different developmental points than kids who are 18 and preparing to go off to university and having romantic relationships. So let's talk about the evidence for mindfulness. And there's just so much that's being published in the last 10 years on mindfulness. And we're seeing generally some positive impacts. Still, there needs to be really rigorous work done, but in general, we're seeing some nice positive impacts of mindfulness. So let's go through the evidence. So in the adult literature, we have a lot. So lots has already been done in adults, and we see mindfulness being applied to both clinical and non-clinical populations, and we see an impact of about a medium effect size between 0.3 and 0.6. In kids, definitely in the last 5 years even, there's been a lot more work. The bulk of the research in kids is with non-clinical populations. So mindfulness in the schools, for example, in Ontario and Toronto area, several boards have adopted the Mind Up Goldie Hawn's program, and this is being applied to kids who are, don't have clinical issues. So we have far fewer studies that are coming out on clinical populations. There are some, and like I said, there's some being, in 2017 alone, there was a lot more published. So let's look. So we have some studies on externalizing disorders, anxiety, substance use, and mixed mental health conditions. There's only one RCT, at least from this review, the Zugman review, and that was Gina Begel's work, where she did a really nice RCT looking at a mindfulness-based stress reduction course compared to a control group. And what this Zugman review concluded, they looked at about 20 studies implementing mindfulness with children and adolescents. And they found that the impact of mindfulness was 3 times more impactful for clinical populations than non-clinical populations. So it's really a good thing for kids who are struggling with some psychopathology or physical health issues. And the greatest impact was for psychological symptoms like anxiety and depression, so psychopathology. So mindfulness was really able to reduce the scores of kids in terms of their levels of anxiety and depression rather than other types of things like heart rate, those kinds of things. I'm going to go into some of the adult systematic reviews, and this is a review from VHOF. It was published in 2016, and VHOF looked at RCTs only, so polled RCTs that had implemented a mindfulness or acceptance-based approach. There's something else called acceptance and commitment therapy, which has elements of mindfulness, but the concept of mindfulness and acceptance and commitment therapy is somewhat similar in terms of being able to detach from autopilot and especially uncomfortable experiences and return to the present moment. Acceptance and commitment therapy differs from mindfulness in a focus on helping people be aware of their values and helping them to understand that they'd be moving towards valued directions in their life, like family. I really care about my family, and I'm going to bring my pain with me so that I can do something with my family tonight. Whereas mindfulness doesn't have a focus on values, on helping people to identify their values and what they care about. So acceptance and commitment therapy goes that kind of one extra step, but it does include mindfulness. So this review looked at 25 RCTs. The main participants in these studies were female, ages 35 to 60, and it looked at acceptance or mindfulness-based interventions versus waitlist control, treatment as usual, or an educational support control group. And you can see on the side here effect sizes as a way of evaluating the impact of research of an intervention, and a 0.2 effect is a kind of a small effect, a 0.5 is a medium effect, and a 0.8 is a large effect. And so we see for pain intensity, immediately after these adults were involved in a mindfulness or acceptance approach therapy for their pain condition, they had a small impact on their pain intensity. We're just looking at the first column where it says post-treatment. They had a moderate impact on their depression, quality of life, and anxiety. And pain interference describes things like impact on function. So there was a pretty good impact on their function right after finishing these mindfulness or acceptance groups. There was a nice impact on function, but you can see pain intensity isn't, it's just a small effect. And that really speaks to the idea that mindfulness-based interventions, it's not about taking people's actual physical pain away. It's more directed towards that secondary suffering of helping to reduce the distress, the distressing thoughts, the distressing emotions, the behavioral consequences of, sleeping during the day or feeling very much like you can't concentrate in your life, that you're not being effective. So those kinds of things is where mindfulness, we see the strong impact of it. What I want you to notice in this slide is the follow-up column, that you see that the impact, the effectiveness, 3 to 6 months after finishing these mindfulness or acceptance groups is really shifting, so that with time, the thought is people are practicing these techniques and they're actually having even more impact. So pain intensity moves up to a small to medium effect. Depression stays in the same range. Quality of life is improving in the follow-up period. And look at pain interference. So people are really, looks like they're practicing these new skills that they're learning through mindfulness and acceptance, and it's really changing the disruption of pain in their lives. I'm going to move forward and not go into too much of the brain imaging because I'm just looking at the time and I know we want to leave some time for questions, but I do encourage you to check out Sarah Lazar's research that shows, really powerful changes in the brain that are attributed to mindfulness. And I also want to introduce you to the name, if you're not familiar, Fadel Zaidan, who has a research program looking at mindfulness meditation on pain processing. And his research is mainly focused on healthy individuals, but he's showing that in 4 20-minute sessions, for days, 20 minutes a day of teaching mindfulness meditation, he's been able to show changes in the brain pre and post that 4-day training and changes in pain perception. So he's actually showing correlations between mindfulness meditation and the brain, which is very, very exciting. And he's got a nice TED Talk that I'm going to just give you the link to at the end of the talk. Okay, so we're not going to go through all of this, but it just shows that mindfulness essentially is very different than deep breathing, than relaxing, or distraction. It's got very different mechanisms in the brain and is associated with more of a top-down process of frontal executive functioning in the brain. So I'm going to talk to you now about our 8-week pilot study implementing this 8-session mindfulness group for adolescents from our chronic pain clinic. This was a pilot, and now we're running a randomized controlled trial that's just started looking at the same group, but kids are either randomized to the mindfulness group for pain or treatment as usual. And we're excited to look at those results. And we ran this group from 4:30 to 6:30 for 8 weeks, and we had a fall session and a spring session. It was 2 hours. All kids had a chronic pain condition. They were assessed with outcome measures before doing the group, immediately after the 8 sessions, and then there's a 3-month follow-up after. There was also a parent workshop where the parents of the kids came in a concurrent session at the second session. So it was a one-time parent workshop to learn about mindfulness and the skills that their kids were learning. And I'm not going to be presenting data from that parent workshop today. And then we held a focus group when the teens were finished their group to get their input, their feedback on the group so we could modify it for the RCT that we're running now. And we really want to know, is this feasible? Do teens with chronic pain want to come to a mindfulness group? Do they stick with it? Did they drop out? What's happening? And then we were also, of course, interested in the effectiveness. Is it helpful at all? And I'll report on that in a moment. And you can see the key messages that we had across sessions, improving ability to be with pain. So that meditation where I showed that girl's drawings of being able to actually go down to where we're experiencing some discomfort and see if we can have some different ways of relating to that. Letting go, responding instead of reacting to situations. The 6th and 7th session are really on self-compassion. We do formal meditation, breathing, body scan, eating meditation, walking meditation. And we really, as I mentioned, try to incorporate a lot of fun experiential ways of showing that, illustrating mindfulness concepts using props and that kind of fun stuff. So we had kids were eligible if they were between 13 to 18, that they weren't in significant psychiatric crisis, meaning actively suicidal or psychotic. But other than that, they were invited to the group. We had about 42 kids who were eligible, and about 50% of those actually enrolled. And the number one reason for people not being able to do the group was, they had after-school activities. And that remains a big issue. The other big issue that we're encountering in our RCT, which has become a big issue, is the idea of proximity. So we see kids from around the large area of Ontario, and some kids live 2 hours away from the hospital, and it's just too far for them to drive in for 8 weeks. So the idea of giving mindfulness, delivering it through an online medium is being explored now through a collaborator, and we're interested to see how that might work to give access to patients who would otherwise be unable to do the group treatment at the hospital. And you can see that on average, kids were about 15 years old. They'd had pain for quite a long time, in months, about 36 months. The vast majority had musculoskeletal pain. We had one male, but the majority of our group members were female. So we had one brave boy who came, and he was a great group participant. So we had really good retention. We had about 90% of participants complete treatment, attend 6 out of 8 sessions, no dropouts, and the satisfaction rating was high. And I think part of the reason for that was that we had kids who all came with a chronic pain condition. We had used to run these groups with mixed populations, so kids who had diabetes, kids who had chronic pain, kids from eating disorders, and we got feedback from the teens with chronic pain that they really wanted to be with each other, and they really wanted the material to be more focused on how they could learn strategies for pain management. And so that's when we start to modify the group specifically for teens with pain. And that might be one of the reasons why we had good retention rates, because they felt like, wow, I'm meeting people and who are like me, feeling less alone, feeling like they had the same issues as the other kids, and also learning from the other kids in the group. Like, the most powerful thing was when teens would come in and talk about using some of the mindfulness strategies during the week and how they implemented them, and then the facilitators would just take a back seat because that was so powerful for their peers to hear from peers about the usefulness of these techniques. So what we see in terms of our outcomes with this initial pilot study, I'm just drawing your attention to the Chronic Pain Acceptance Questionnaire, which really looks at how much the kids are changing in their ability to accept the pain. That I'll show you the items in a moment, but we see that there's a significant change between baseline before they started the group to 3 months follow-up. So not immediately after the intervention, but it was 3 months after they finished that we saw these big changes before they started the group to the 3-month period. So it's things like, here's that questionnaire that we saw the big changes on. My life is going well even though I have chronic pain. It's not necessary to control my pain in order to live my life well. So people were changing in those areas. I need to concentrate on getting rid of my pain. I avoid putting myself in situations where my pain might increase. People were having decreased feelings of those things. So this idea of fighting, resisting their pain, needing to control their pain, there was a lot of space that the teens were able to cultivate in responding to their pain differently and not feeling as much secondary suffering as they did before they were in the group. And then every session from 1 to 8, we administered a post-session questionnaire where we asked about, today's session helped me cope with my pain, my stress. Today's session helped me become more aware of my body. Today's session helped me feel less alone. And we see that from the first session to the 8th session, we saw changes in the areas of the sessions helping them to cope with stress and the sessions helping them to cope with, to be more aware of their body, so that body awareness. So what are some lessons learned from running these groups? One thing was we're just writing up a qualitative paper looking at the focus groups where the teens were audio recorded and really gave feedback about what they got out of the group and what they suggested should be changed and things they didn't like. And the vast majority, like emphatically, really so appreciated being with other teens that had the same thing. It was, for some of them, the first time they'd met someone who had chronic pain. So that was a big deal, and they really enjoyed practicing the techniques together. So the group modality rather than one-on-one delivery of mindfulness was really important. If you are going to run groups, another comment from a participant who was quite young, we had a lot of older kids and then this young kid in the group, and the older kids were like her big sister. But she was brave enough to say in her feedback that, it was hard being the youngest. She just felt in a different stage, and she really advocated that if we're going to include younger kids, have a few of them. So just being really cautious to look at the developmental groupings and if you're doing groups with kids. The other piece is when we're working with kids and or anyone really in really approaching those parts of their experience that are so challenging and so so difficult, so physical pain, the areas of pain in their body that hold not just physical pain but a lot of emotion, and people often don't want to go there. To really introduce those meditations with in a paced way. So when you're getting people to start doing that, you can give suggestions at the beginning of the practice to say, you don't have to go to an area that's too hard today. Go to an area that you think you can work with today. Maybe there's a little bit of discomfort, and that's a place that you can start with. Just practicing being with that today. You can use words like starting the meditation, the practice with, let's see if you can carry with you in this practice an attitude of openness to your experience and an attitude of being tender and gentle with yourself, so that as people may experience some distress as they are experiencing things come up for them in the practice, they can have those cues of being gentle with themselves and having an attitude of tenderness and kindness, and that can just kind of let the air out and decrease a bit of that sense of distress, and can create a more successful experience of practicing being with some of these areas of discomfort. And of course, coming back, returning to the breath whenever they need it, using the breath as a ground, as a touchstone. And always helping people understand that it's not about this feeling of peacefulness or calm when we're practicing mindful meditation. It's the ability to notice and observe where our mind is going. And then if we are going off on some autopilot mode, the ability to bring it back. Notice we've gone off and bring it back. And that's really the piece that is really cultivating a practice of being able to unhook from rumination or unhelpful dwelling on unhelpful areas of thought or of physical sensation, and returning to the breath. So really reinforcing that concept when we're working with the teens of, you were just being mindful there when you noticed that your mind was wandering and you brought it back. That's mindfulness. Also setting reasonable expectations at the beginning of the group. So letting people know that this is not going to take away pain. This is about, it could help with your pain, but it's really about changing your relationship with your pain and the idea of reducing that secondary suffering that I presented in some of the early slides. So we are starting our randomized controlled trial now. We are looking at parent proxy measures, actually. So we only measured in our pilot study children's self-reported depression, anxiety, pain acceptance. But now we're going to ask parents to also provide ratings on how they are seeing their children's emotional functioning. We're looking at healthcare utilization. And we really hope that if there is some impact from this RCT, the wonderful part of mindfulness is it doesn't need a PhD level person, a doctor, whoever to administer it. As long as someone has a mindfulness practice themselves, they can actually facilitate mindfulness. So it's a cost-effective, implementable strategy as long as we show that it's got some effectiveness. And I think that literature is growing. So I just am showing you two resources that you may want to visit. Vidyamala Birch is someone who her book, Living Well with Pain and Illness, has been a wonderful book that I've learned from and that I give to people that I work with, and they really find it very helpful. And she's developed in the UK a mindfulness program for pain management called Breathworks. So that book is wonderful. It's got beautiful practices in it, and it's very that you can use if you're working with people who have chronic pain. She actually has a chronic pain condition herself, so she has a lot of credibility. And then here's a TED Talk by Fadel Zidan, who has done all that very elegant research on neuroimaging and pain using mindfulness. He's the one that teaches people for 20 minutes a day for 4 days, a mindfulness technique, scans their brain before they learn that technique and after, and sees big changes. So he's done a TED Talk that you can visit. That's really interesting. And I think that is it. So I will open it up to questions from the audience.
Okay, to our audience, if you have any questions at this time, please enter them into the question box on the GoToWebinar panel, and we can read them out loud. A few questions that came in over the course of the presentation. Do you have any resources you can recommend to help with our mindfulness practice, specifically related to pain?
Yes. So again, I would encourage you, the first person that comes to mind again is Vidya Mala. Her slide is up right now, and she's got, if you Google her on YouTube, she's got some nice practices that are recorded in video format, and they are neat in just starting with, but I can't speak highly enough about her program.
Okay, we'll include that in the resources in the follow-up email as well. Mm-hmm. Another question, did you find in your group studies that group modality was more like peer pressure, or was it more of a supportive atmosphere with the adolescents assisting each other with the practice?
That's a great question. I really have to say, after facilitating many groups, I'm always blown away. It brings tears to my eyes, actually, when I'm in after the group, sometimes how supportive the teens are of each other, and of sometimes, they can be very open about, that was really hard for me, like that whole approaching pain meditation that we just did, that was really hard. I didn't like it. That I don't like paying attention to my pain. And another adolescent would say, you know what, I really liked it. I really found that changed my experience. So I think in hearing those comments, teens felt a sense of comfort with each other. And we know from the focus groups that they really felt that they had each other's backs. And I think to cultivate that in the groups, we really try in the first 2 sessions to have a lot of time for them to just connect with each other and relate to each other. And in fact, we don't talk about their pain that much in the group. We don't have a go around where people talk about what kind of pain condition they have. It just kind of is the sense of we're all here because we have a pain condition. We come from the same clinic. So I get a sense that there isn't. I have never felt that there was a peer pressure. There's a lot of support, and in fact, the kids, after they finish the group, connect with each other and go out with each other. We hear.
Okay. Another question that came in, do you believe neuroplasticity is a useful tool in the self-management of persistent pain?
Okay. I think here's what I think. I think that educating people about the research showing that the brain can change and giving them some of the evidence that we're seeing gives a little extra sense of empowerment and maybe openness to mindfulness. So I think if you can read up or watch or become familiar with the research on neuroplasticity in chronic pain, it can go a long way in letting people know that this can actually have a big impact. We talk a lot about it's like going to the gym for your brain. So you go to physio for your body, but this is like going to the gym for your brain. And TV Ontario in Ontario has done a whole series on changes in the brain for kind of the general population. I can see if I can find that resource for people after. It's really neat. There's the host actually subjects himself to mindfulness and has brain scans before and after, and so you see this actually happening in with the host. So I think bringing education in and educating our population on the brain changes is a great route in.
And one last question before we end our session. Do you know the size of the population of adolescents, children in Canada with chronic pain?
So it's 1 in 5. 1 in 5 kids have chronic pain in Canada. Yes, it's a very high number.
Okay. All right, that concludes our question and answer period for this time. Do you have anything you'd like to add following your presentation, Dr. Ruskin?
Just that I hope people are welcome to reach out to me. I'm at Sick Kids and my name's in the talk, so you can look me up if you want to reach out with any other inquiries. And I wish you all the best.
And thank you very much for your presentation.